According to the CDC, the Omicron variant BA.5 has been consistently becoming more dominant since May.
In fact, at the start of July, it officially became the most dominant strain, accounting for 53% of isolates, increasing to 65% this week. Dr. Frank McGeorge here with a local health systems warning on just what that means. Doc?
Well, you know, Kim and Devin, the biggest reason for BA.5's rise to prominence is that it seems to be able to evade whatever immunity we've acquired better than prior variants could. Now, of course, there's also an element of increased transmissibility, plus the natural decrease in our collective immunity over time since our last set of vaccinations. Add to that fewer people taking personal precautions, and well, we're seeing another increase.
I do believe that we are now in another surge. This one is being primarily driven by the BA.5 variant of Omicron.
That's Dr. Dennis Cunningham, Henry Ford Health's Director of Infection Prevention.
This week, the number of hospital admissions in Southeast Michigan has started to increase again. When you look at Macomb, Oakland, and Wayne counties, new hospital admissions for COVID jumped up an average of 13% over the past 7 days. So I think we're starting to see some more inpatients.
But so far, the hospital pattern is different than in prior surges.
While we have more admissions, we're not seeing more patients in the intensive care unit. Why is that? There's a couple of different factors. One could be that BA.5 isn't quite as nasty as some of the earlier strains we had, such as Alpha, Beta, Delta. We also now have the oral antivirals.
Based on current infection rates, some experts are estimating BA.5 could infect 10 to 15% of Americans in the coming months. And while many people have different experiences, here's an idea of what to expect.
So the BA.5, it seems to be a lot like the other Omicron variants, a lot of cold symptoms, fever, aches. One thing that was reported in Great Britain where BA.5 is driving this, it does seem to be causing more of a hoarse or scratchy throat, a hoarse voice.
Now, at this point, Dr. Cunningham is recommending that indoor masking is again something that people should consider, especially in more crowded settings. Now, fortunately, of course, summer in Michigan means more outdoor opportunities where masking really shouldn't be necessary.
Well, Frank, given that BA.5 seems to be less virulent than the prior variants we've seen, how big a concern is there then over more deaths or severe illnesses, which has really become our focus when it comes to COVID?
Yeah, well, you know, there is certainly less of a concern than during prior surges, but in the end, it just becomes about math. You know, even if an illness kills a smaller percentage of people, if enough people get infected, a smaller percentage of a bigger number is still a big number.
Right.
So it's still going to tell, it's still going to be necessary, I think, to tell people to just be sensible.
Yeah, great reminder. All right, Doc.